Good afternoon, everyone. Welcome to the City of Alameda Mayor's Town Hall. I'm Sarah Henry, the city's Public Information Officer. Joining us today from Alameda Health System are Dr. Minnie Swift, Vice President of Population Health and co-lead of their vaccine program, and Dr. Jason Jamiluddin, Chief Medical Officer, who is leading the efforts with Dr. Swift. Joining us from Alameda County Public Health Department is Anika Chaudhry, Director of Strategic Initiatives and Public Affairs, and joining us at 12:30 is Dr. Nicholas Moss, Alameda County's Health Officer. Please note that all participants have been muted. To submit a question for the mayor or for any one of our speakers, please use the chat feature. All of our town halls are recorded and are available on the city's website and our YouTube channel. I'd now like to turn today's town hall over to Mayor Marilyn Ezzy Ashcraft.
Thank you, Sarah Henry, and thank you to our fabulous guests for joining us today, taking time out of your extremely busy schedules to help educate our public. You know, it has occurred to me, just thinking about and prepping for today's town hall, that we have all been enrolled in a crash course on the COVID-19 pandemic for the better part of a year. You didn't sign up for this class, you were automatically enrolled. And we have had to learn, I mean, there are terms in your vocabulary that you didn't know before that, before this all happened. And we have been through a lot. I'm very hopeful. I see this as light at the end of a very long tunnel, the vaccine rollout that we're now embarking on. So we've entered a new chapter of this crash course. Now, the tricky part about studying for the exam is they just keep updating the information. I mean, that's the good news. We know more about this virus. We know more about these vaccines that have been developed to fight it. But at the same time, the virus mutates, and now there are new variants. And so, you know, there's always something more to learn. But now we are not only learning about the vaccine, how it works, but also how we're going to get all of you vaccinated. I'm really excited because I think, well, over the course of this pandemic, the residents and businesses of Alameda have really been very conscientious about doing what they were being asked to do. And I know you're going to continue. There's a lot of just positive energy and momentum about getting the vaccine, but we just want to do it yesterday. So I am so excited to introduce you to these experts who are going to talk and then more importantly going to answer your questions. As Sarah mentioned, I think she mentioned at 12:30, our Alameda County Public Health Officer, Dr. Nicholas Moss, will join us and he can answer more of your questions and he can give us some updates. The situation is changing truly by the minute. So for my fabulous medical experts who've joined us, Dr. Jamiluddin and Dr. Swift, who would like to start? You tell me who would like to take the first round here.
I can probably start and then
Please.
give the stage to Dr. Swift to give more. Thank you, Madam Mayor, and thank you for inviting us. And good afternoon, everybody. It's so nice to see you all. And it is so fortunate that we have this opportunity to talk to the public and be able to answer questions. And indeed, Madam Mayor, when the vaccine came, it was really like the light at the end of the tunnel. It came to us as a healthcare system while we were really here in California at the peak of the COVID-19 cases that are really filling our hospital in Southern California and Northern California, more so in Southern California. Now, just to introduce where we are with the vaccine really started as soon as they were able to isolate and like sort of genetically get all the information about the virus. And within about 6 months, there were multiple vaccines in the pipelines, and some of them really were standing up. And 2 of them were standing up with a new platform. It's called messenger RNA utilization. And these are produced by biopharma in collaboration with the state and federal government in the United States and in Europe. And those companies are Pfizer and Moderna. And Pfizer was the first one to apply for an emergency utilization back in November to the FDA about using the vaccine. And this was done after they have done what we call phase 3 trial, where the vaccine has been tried on thousands of people and demonstrated to be effective, to be safe. And when we say safe, that means there hasn't been any side effects that precludes its utilization. There were side effects, but there were tolerated side effects. It was like the influenza vaccine, where some people would get some muscle pain or a little pain or swelling at the site of the injection. So the Pfizer got the emergency utilization on December 11th, and within about probably 6 days, we had it here in Alameda, and within 24 hours, we started to vaccinate people. Now, the process of vaccination followed an advisory that came from the CDC. There is an advisory committee on immunization practices where really you have to follow a certain waves. And I will let Dr. Swift talk about these waves, how we have followed the Center of Disease Control recommendation and the State Department of Health recommendation in terms of our deployment of the vaccine. I just want to highlight a couple of messages to the public about the vaccine. The vaccine is safe. It has side effects, but these side effects are tolerated and are within like 24 hours, they disappear. That's number one, which is extremely important. We have a second company that got also an emergency utilization authorization. It is called Moderna, and they started to ship also vaccines all over the States. And we have it also in possession, and we are starting to utilize it also here in Alameda Health System, Alameda County. So we have now 2 companies that got this authorization. So first, the vaccine is safe. Number 2 is we are going to really follow a process to be as much as possible vaccinating the vulnerable people and the people who are like at risk to get the infection. Number 3 is what you just mentioned earlier about the mutation of the virus. So far, there is no indication that the mutation of virus has affected the efficacy of the vaccine. And there is a lot of scientific explanation for this, but the vaccines that are being used so far have demonstrated efficacy. With this, I'm going to pass on to Dr. Swift to give a little bit more details about how she has implemented the vaccination process for Alameda Health System and interacted with Alameda County HICSA. So, Dr. Swift.
Thank you, Dr. Jamaluddin and Dr. Swift, an Alameda native and Alameda resident, by the way. We welcome you, please.
Thank you so much. Good afternoon, and thank you so much for allowing us the opportunity to share what we're working on here. As Dr. Jamaluddin mentioned, within 24 hours of receiving the Pfizer vaccine, we began to administer the vaccine to our staff. Many of you may know there's a specific methodology and a phased approach that we are supposed to be following based on CDC and state guidelines. In this first phase, there are phases, there are tiers, but the first 2 groups of people that we were vaccinated were really people living in our long-term care facilities. So here in Alameda, that's at Park Ridge, South Shore, subacute at Alameda Hospital. And then we were also focusing on providing the vaccination to our staff. For the patients, we have, like other organizations, partnered with Walgreens. I know CVS has also partnered with organizations in Alameda working on Walgreens, and many of our residents have received their first vaccination as of today. For the staff at Alameda Health System, we have been asked to focus on our staff that are most essential to our society's response for the COVID pandemic. So we began with our acute hospitals, all 5 hospitals, particularly here in Alameda. We're delighted to report that we have provided the vaccination to the first dose to those individuals who wanted the vaccine. This week, we started providing the second dose to that group of individuals. We have also, in accordance with our phasing requirements, have begun to provide the vaccination to the ambulatory clinics within Alameda Health System. So primary care providers, specialty providers, folks in our outpatient services have started to receive their first vaccination. And we have provided this to approximately 70% of our workforce and will continue to move forward. We are also in plans, we are planning to very shortly provide the vaccination to our patients who are assigned to AHS who are over the age of 65 and who are essential workers. And so we will complete that planning and start that vaccine opportunity for those individuals very soon as well. We currently have both Pfizer and Moderna. We have more doses of Pfizer and some of Moderna. And so are trying to, it's a little bit like a Rubik's Cube, trying to manage the cold storage chain requirements, the requirements to prioritize certain populations of people first, and to at the same time never waste a single dose. We see these as each dose as a sort of hope diamond that we're doing our best to keep safely and administer expeditiously, sorry. With that, I'll stop.
Thank you, Dr. Swift. And now we have Anika Chaudhry from Alameda Healthcare Services Agency, and she is amazing. She keeps up on all of the changes by the minute in the vaccine protocol supply, what's happening next. So Anika, I'd like to call on you next to just tell residents, I mean, the number one question that I'm getting from people is, when will I be able to get vaccinated and where and how and notifications? So I know you've got all that information and more. So Anika Chaudhry, welcome to you, and please, the floor is yours.
Thank you, Mayor. Thanks for having our agency on here. We really, really appreciate your partnership and this opportunity to get the word out about vaccines. So as you've heard, you know, I think at this point, most people are familiar that there's a statewide framework for what order vaccines will be rolled out in. And then you may also be familiar that that framework changes every day. So as of right now, Alameda County is still working through phase 1A, which is largely restricted to healthcare workers. Phase 1B will include people who are 65 or older, and then the first tier, and that includes, and then essential workers. So the essential workers are broken up into two categories. One is teachers, childcare. The next one is, sorry, I have this memorized. So teachers, childcare, emergency services, so that includes law enforcement and firefighters, et cetera, as well as food and agriculture, which also includes restaurant employees and grocery stores. So that's a really big chunk of people in Alameda County. And then the remainder of phase 1B would be other critical infrastructure and other sectors. So, you know, effectively the state has tried to base those prioritizations on your risk for either getting really sick from the virus or your risk as a part of your occupation in getting exposed to the virus or being able to spread it to others. And so at this time, vaccine is limited. And as I said, we're working through 1A. In another couple of weeks, we think that, you know, hopefully vaccine supply will increase and we'll be able to move on to phase 1B and have more people come in. One of the things that we've done on our website is, and I can drop the link in the chat, is that there are 3 icons on our vaccines page that you can sign on to. And this isn't for an appointment to get a vaccine, but what it does is that you can share with us your contact information, and we'll ask you for basic demographics, like what's your age, what zip code you live in, and then on the back end, we can pull that information and then contact you when there's vaccine available. So our overall strategy is that, you know, ultimately you will be able to get vaccine through a county point of distribution or a pod, which we'll have in the community, and we'll do giant ones and we'll do little ones. Or you'll be able to go to your doctor, you'll be able to go to a community clinic, as Dr. Swift said, you know, ultimately, eventually also pharmacies. So as vaccine supply grows, you'll be able to get it in more places. But over the next few months, it's going to be kind of metered out. And so, so we don't have a definitive answer for when you can get it. If you are a healthcare worker, you can get it right now. But if you're not a healthcare worker, then, you know, there's other factors in play.
Thank you, Anika. And now I think it is, let's see, 12:21. So Dr. Moss is joining us at 12:30. I know we've got a lot of questions coming in. So Sarah, why don't we start taking some of the questions that our guests can speak to now. And then when Dr. Moss, our public health officer, who's just carving a little time out of a very busy day comes, we'll hold the questions, hear from Dr. Moss, and we'll go back to question and answer.
Perfect.
So-
Yes, I do have a bunch of questions from folks. So the first question, Anika, you addressed this, but just to ask, so the Gov site shows phase 1C as 50 and older. The media and the state are talking about 65 and older. They really want some clarity here. They're 60 and they are eager to get their vaccine.
And
Sorry, so phase in 1C, it's 50 and older, but in phase 1B, it's 65 and over.
This person is 60.
So then you would fall in phase 1C unless you are you happen to work in one of the sectors that falls in 1B.
So this person, so for folks in 1C, they should fill out the form. That's and wait. Okay, that's the
Yes,
great,
please.
perfect.
Yeah, and on the form we do ask you what sector you work in, so that you know we can kind of sort it on the back end and see when we can get it to you the earliest possible.
Great.
And I'll just chime in and say it's really easy to fill out that form to get registered, so you'll get the notification. And when Anika says you have to identify your occupation, there's a drop-down box. You just click. There's certain choices. The information is all confidential, and it's a good thing to go. And you did put into the chat box the link to do that. Perfect. Okay. Next question. Sarah.
Great. Next question, is the vaccine program based on where you live or where you work?
Who
Anika,
wants
I
to
think
take
for you.
that? Yeah.
It's a little bit of both. So right now, you know, for example, for healthcare workers, we have a lot of people who work in Alameda County but don't live in Alameda County. But our goal is to get as many people vaccinated as possible. So for the so we'll be letting employers know when there's vaccine, like any Alameda County employers, we'll be letting them know when there's vaccine available for their employees and where they can go. But then, you know, again, kind of back to that question we just had about the age. So you might fall into a category where your age or your underlying health conditions allow you to go before a certain sector, in which case check with your doctor if they have it available, or also check with your county of residence.
Great.
And I'll also add that the registration where you can go to register, there's one section where individuals register, there's another where employers register. So if we have folks listening today who are employers, check that out.
Next question, I think it's another one for you, Anika. There are dozens of questions here, though, so I'm going to get through as fast as I can.
No worries.
This person is a healthcare worker. They're eligible for Tier 1 vaccine, according to the website. They say that it's incredibly frustrating because they're a self-employed healthcare worker, an independent contractor. So they're living in and serving patients in Alameda County and beyond, but they're not able to secure a vaccine. They've called, they've emailed, they've checked the website, and they just want to know how they can get their vaccine.
Yeah, and so the best answer I have is to fill out the healthcare providers form on that website. So independent providers and independent physicians associations, we've been working in partnership with our hospitals as well as our clinic partners and other places where we can get people in. And so, but at this point, you know, I'll note that we estimated about 145,000 healthcare workers in Alameda County. And we've received about 85,000 doses of vaccine, of which 53,000 are first doses. So the supply is limited, and so we're just working through it as quickly as we can.
Great. Next question, the person says they're eligible to receive the vaccine as an IHSS home healthcare worker, but they can't find any place to actually get the vaccine. They've called their primary care physician, Department of Health, Walgreens, CVS, every place they can think of, and nobody seems to have the information for them as an IHSS home healthcare worker.
I do. So
That's why we have you.
We have about 24,000 IHSS providers in the county, and we wanted to make sure that we notified everyone all at once of their options. So if you are an IHSS provider who is insured through the Alameda Alliance for Health group care program, you will get notified by them about where to go for appointments. If you are not insured by group care, then you will receive information from Alameda County going out today about appointments available for next week. And then we'll also be sending additional information in the coming couple of weeks so that, because we know it's going to take a little while to get through the large group of people.
Great.
That's good news. Thank
Wonderful
you.
news. The next question, this person's 65 with a pre-existing condition. Their mom is 96. Where can they get the vaccine in the city of Alameda, they say?
I would
Yeah, who wants to take that?
sorry, unless my hospital colleagues have an idea about where that might be available. We don't have any county pods in the city of Alameda at this time.
We are,
Swift, Dr.
Minnie, do you want to
Hidrogen?
answer? We are working with the healthcare services to see where we can have access as much as possible, convenient for every single citizen. So we don't have an answer yet, but we are working on it effectively.
And I will just say to the doctors, the city of Alameda wants to partner with you. We have some areas that we've already been discussing with staff. So let's stay in touch.
Absolutely.
A similar question, but a bit different. This person's asking, will they be able to choose where they go to get the vaccine? This person has had anaphylactic reactions before, so they would like to sign up at a hospital in case they need to get to an ER quickly.
I think that's one for Dr. Swift, perhaps, or Dr.
Hi, yeah, I certainly support the desire to be closer to an emergency department or urgent care. As I mentioned, we're currently in the process of planning for patient care. Our clinic at Alameda Hospital is currently a staff clinic. And when we get to those tiers for non-healthcare workers, I think that's something that we need to consider.
I just would want to add that in our vaccine delivery model or modules, we are going to be ready for anything like this, anywhere we give the vaccine. So we use the word STEEP, which is safety, timely, efficiency, equity, and person or patient centered. So this is what we are going to do. We are going to be, hopefully no one will get an anaphylactic reaction, but we'll be ready to take care of everyone.
Great.
Thank you.
And I'll just add that at the county pods, wherever we plan for them, as you know, the process to go through them is the registration, making sure you know who you are, getting the shot, and then there's about a 15 to 20 minute observation period where there are clinicians watching you. Just as Dr. Jamaluddin said, the idea is we wouldn't put a pod anywhere we didn't have that ability to monitor people.
Thank you. It's reassuring.
Two quick comments. One comment to ask that we bring Moderna as they're better geared toward results for the elderly. And then another comment to ask for a drive-up location in Alameda when we get that pod for people that are 75 and above. And then the next question is asking, what about the recent spike in COVID cases in the SNFs, the skilled nursing facilities in the city of Alameda, and the dangers given the vaccine to the elderly? And for this, the person refers to the news from Norway, where people from their SNFs have died. They said this is what they're saying in that comment. So what can be done for our skilled nursing facilities?
Maybe I can start answering, and then I will give to Dr. Swift. I think the first question was related to the difference in the age efficacy of Pfizer versus Moderna. And that's probably true. The study design has led to this, but it doesn't mean that the Pfizer vaccine is not effective in the elderly. It so happened when they did the third, what we call the phase 3 trial, that they looked more at this data. So I wouldn't say that we shouldn't vaccinate the elderly with the Pfizer. The science is not supportive of this, but the design of the study in the phase 3 with the Moderna showed like this increased efficacy. So that's like the number one thing that I would say. Now, in terms of, we had a number of outbreaks in the skilled nursing facilities, and part of our healthcare system, we have one outbreak in Parker Bridge that we did everything like everyone else to contain this. As you know, there has been a lot of regulation that we have been adhering to from very early in the pandemic to test every residence regularly and to test every employee regularly. And many a time those outbreaks are like detected on this surveillance testing rather than testing for people getting sick, especially in this phase of the pandemic. Now, as to the vaccine, I let Dr. Swift talk about how we have vaccinated our skilled nursing facility, because we have started to vaccinate people in skilled nursing. Dr. Swift.
Sure. So we have a partnership with Walgreens and AHS, and Walgreens has come out on a couple of occasions and provided vaccinations to our patients and some of our staff. Per CDC guidelines, anyone who has tested positive or has a COVID infection, we're not supposed to vaccinate them during that time, but we can after they have, after that time period is over, after their infection is over.
Thank you. And then I was just going to ask Anika, I think the both Pfizer and Moderna need to be stored at certain temperatures, but I do think the Pfizer vaccine is the more demanding of the colder temperature and requires those special freezers. Do we have enough of the freezers, refrigerators we need to preserve that important cold chain?
Yeah, so the county purchased, we had some minus 80-degree freezers in our lab, but then we've also purchased additional. And many of the hospitals have also purchased those freezers and are ready. So we do think we have enough storage capacity for those. And for the Moderna, that can be stored in a regular refrigerator. And so there's plenty of cold chain storage.
All right. I think I see Dr. Swift nodding too. Yeah. Okay.
Yes, at Alameda Health System, we have a few of these freezers that can maintain this Antarctic level temperatures. One of them is sitting at Alameda Hospital.
Right, good to know. Well, I've just been notified that Dr. Nicholas Moss, our very busy Alameda County Public Health Officer, has arrived. And so we're going to hold the questions for the moment, and let's welcome Dr. Moss. And where is Dr. Moss?
I am here. Can you hear me?
There you are. I see you and
Yes.
hear you now. Yes, thank you. Thank you so much for joining us, Dr. Moss. We know how busy you are, and so we're so grateful to you for carving out this little portion of your day to address. We have a really robust group just here on the Zoom, and I know there's even more watching on Facebook. So thank you so much. Dr. Moss, what can you tell us? As I was telling people in the introduction, the news, the information seems to be changing by the minute, and I know you're close to the source of some of the information coming in. So please, what can you tell us? And the floor is
Sure,
yours.
and I just caught the end of the earlier discussion, which sounded great. I'm sorry to have missed it, but very glad to be here. Thank you for the invite, Mayor, and I think, busy as we are, this is the important work, meeting with county residents. So I think you're asking about vaccine news specifically, Mayor, right? I see you nodding. So, okay, yes.
Is there anything else to discuss?
I think that first we just have to acknowledge that, yes, it has been very much a shifting landscape, and it's even today we're getting new news about things at the federal level and all of that. And I think it's important we all step back and acknowledge a couple things. One is we are all trying, and I'm not saying this to make excuses, but I think to set the frame, we in public health and are across the country are trying to do something a little bit different than we've done before, which is the COVID vaccine program for an illness where you have to be very careful about getting people together in the middle of a pandemic surge. It's going on right now in Alameda County and in California, with vaccines that people didn't really even know much about until we heard the first effectiveness data in November. That's only about 2 months ago. And so in some ways, I think actually it's not surprising that it's been so much up and down. I also think at all levels there could have been some improvements in planning. Anika and I talk about planning all the time, and we do a lot of planning in Alameda County, and sometimes we're at the mercy of what happens in other places. But so people are doing their best. We think that it would have been great if maybe some things happen differently, but this is where we are. I think that the other thing that's important to realize is vaccine is going to keep coming. We have good vaccines out there. They are effective. They are safe. The data from the trials, I don't know if my colleagues on this call have had the chance to read the FDA or the journal articles. My guess is yes. And that it's very reassuring. I think no corners were cut. These are good vaccines. Obviously, emergency authorization. We'll learn more as we go. But I feel confident that we have something here that is really going to help. And so I think that that has not changed. But we need to get more vaccine into Alameda County. It's going to happen more slowly than we had hoped. I'm not going to promise that I'm hearing, oh, it's around the corner. Just the opposite. It's going to keep coming in probably in just smaller amounts than we had hoped for the time being. And that means we have to do a really good job of sticking with our framework, but also being flexible to make sure that the people who need it are able to get it as soon as we can get it into their arms. And I don't really have much else sort of new. I don't know anything that anybody else on this call doesn't know in terms of where it's going to go next. But I would prepare for it to go slower than we'd like. But we're just going to keep the momentum going and get it into people's arms.
Thank you, Dr. Moss. I appreciate that. And I also want to just extend my thanks, and I think the thanks of everyone on this call for the hard work that all of you at Healthcare Services of Alameda County have been doing to keep our residents safe and protected as best you can with the ever unfolding knowledge and information. But thank you so much. I know you are all working around the clock, and it does take a certain element of patience, and yet we've done a pretty good job of messaging, and people understand that it's important to get the vaccine, and so they're really anxious to get it. I know there's a lot of questions. The information can be sometimes a bit confusing. So Sarah Henry has been keeping track of questions, and so if you could all stand by for whoever wants to take the questions as they're asked. Sarah.
Thank you, Mayor. So the next question, and I'm not sure if there's an answer to this, but the first they asked how many doses of the vaccine does the city have? And I think that Anika talked about how many the county has earlier, so that's been addressed. And then the next question is, what's the expected schedule to receive additional doses?
Oh.
So I can take that. This is one of the challenges is that we get doses every week, but it's a little bit inconsistent at this point about how many doses we get from week to week. So 1 week we might get 2,000, 1 week we might get 5,000, and until there's a more consistent supply, we don't have a great answer for that. But it's done weekly from the state to counties.
So,
Great.
and Anika and others who've said that people should also be checking with their healthcare providers. So in addition to the supply that you're getting to the county, are these the Sutters, the Kaisers, others, are they getting their own separate supplies, and how does that work?
Yeah, so Sutter and Kaiser, because they are gigantic systems that are in multiple counties, they get their own direct allocation from the state. And then each county gets an allocation that the health department can administer. or the health department can share it with its partners like AHS and say, can you administer this? Or, as we get more and more doctors signing up into the state system, they can then also order. And so but it all comes out of the county's overall allocation. I don't know if Dr. Swift or Dr. Moss
You want
want
to
to
add to that, Dr. Moss? Or?
I was just going to say, I think over time, what this means is that more and more providers are going to be having vaccine and able to deliver it to their patients. And right now it's, it's still limited to some of the large organizations. And but over time, there should be more vaccine and more hands to deliver to their patients. And I think it's really important that, people understand we have a big healthcare system, and we are going to, we are partnering with that system in order to get people their vaccine. But that also means it doesn't necessarily mean, for some people, it's going to be an appointment and you go in and you get your shot. For others, it might mean coming to a larger, like a drive-through, walk-through event where everybody comes, we socially distance, you get your shot there. And so I think there's a couple of things here. We want different options because not everything is going to work for everybody in the county. And the county's role is to not only facilitate and coordinate across the whole system, but also to make sure people who really don't have any other options have a place to go to get vaccine, and that it's going to look different for different county residents.
And so then if people do have their medical coverage through Sutter or through Kaiser, it sounds like they should be reaching out to their providers to get on the list to be vaccinated when their turn in the tier comes up.
Yeah, so there's a couple things. First of all, for older adults, I think it's fine to start reaching out, or maybe next week, if you have one of those large, if you get your care at Sutter or Kaiser, they are starting to. My understanding is they are starting to make vaccine available for some of those older adults. But for others, wait to hear from them. You could reach out, but it might be some time before they have vaccine. And then also you can, Anika probably already said this, you can sign up on our county website to just sort of hear about when you might be eligible, because some of it is tied to the work that people do. And so that's another option, just to get a sense of where we are as a county and, it's time now. So those are the two different avenues people can use to get information. We'll continue to share things publicly across different channels as well, like this one.
Perfect, thank you. Sarah.
Yeah, somebody just popped a note in the chat to say that it took them 3 hours yesterday, but they were able to get an appointment with Kaiser to get their vaccine for next Wednesday. So definitely contact those providers. The next question is asking, what's the strategy to ensure no to ensure no doses are wasted? If doses are left over at the end of the day, what is the strategy to ensure that they're delivered to someone?
I can say, at Alameda Health System, what we've done, we've been in the phase where we have been providing the vaccination, as I mentioned, to our healthcare, our staff. And so what we've done is the staff are divided into different waves based on their role in the pandemic response. The first group were people in more obvious locations like ICU, emergency departments, maternal and child health. We were surprised and delighted to learn that some of these vials actually had extra doses, and hearing of this amazing phenomenon. And so what we quickly learned is that we need to create a standby list. And so much like boarding a plane, we have a list for folks who could be available that day within 20 minutes notice to come to the staff clinic sites to receive their vaccination. And then each department, in many departments, there's a standby list of the day. So internally, we've been able to very quickly develop these standby lists. We have had some partnership with our public health colleagues too. And so we've had their pods come to Alameda Health System. And so when there were these extra doses, we reached into the staff and other healthcare providers and were able to avoid wasting.
Great to hear.
Wonderful.
And I will add that the state has made clear, we have these, priority groups, but, people should not waste vaccine. If you have vaccine and it's going to go bad, get whoever it is in there and get them vaccinated. And that might mean it's going to look like some people are getting it, earlier than they should, but it's not a time for finger pointing or complaining. We really don't want people to waste vaccine. So there's going to be some folks who get it that way, and that's okay.
Yeah.
Next question, somebody's asking, I think this is for Anika and Dr. Moss. What is the daily inoculation schedule? What is required? What is the required throughput of vaccines daily? How are we monitoring and validating that we've achieved the required rates, if there are some rates that are required? And then are we looking at doing extended dosing hours, possibly 24/7, to ensure faster rates in the future?
Go ahead. I saw Anika come off mute for this easy one.
It's yours.
I was going to say so I'll start and Dr. Moss can fill in. So at this point, we don't have an ideal rate, right? So it's as many people as possible based on the vaccine that we have. So the pods that we do have right now are able to do about 1,600 people a day. And those are between the hours of 8 and 4. And again, this is limited and by invite only to healthcare workers. And as we expand and grow bigger, we have other options like, we could go super big in the Coliseum or the fairgrounds, right? And that would allow thousands of people to go through a day, but it's just a matter of scaling up the infrastructure, and we're always limited by the amount of vaccine that we have available.
You mentioned the Coliseum. I think the Board of Supervisors, did they meet this week and decide whether that can be a mass vaccination site?
The conversations are still happening.
Okay, thanks. Okay, Sarah.
Yes. Next question. Are we holding dosing in reserve for the second shot, or are we attempting to maximize the first dose deployment?
We
Well, I'll
are,
ask great questions, by the way.
we are attempting to maximize the first dose. I don't know if Dr. Swift, Dr. Moss agree with me. This is our strategy.
Yes, our goal is to get as many vaccines into deltoid muscles as possible. We are working as fast as we can, and we are prioritizing that first dose. And as we're moving through, some of our staff are up for their second dose, so they are getting their second dose as well.
Great.
Yeah,
Dr. Moss?
that makes sense. I'll say that just this week, the state said for local health jurisdictions, counties like ours, you can keep 50% of what you are holding for second dose. You can go ahead and use for first dose. So they want us to have a little bit in reserve, but loosening up the purse strings a little bit. That is more for us than for AHS.
Great, thanks.
Thank you. What is the priority of teacher inoculation to assist with school reopening?
So educators and school staff who would be at risk are in phase 1B, tier 1, I believe. So they're pretty high up there in the list. And I think that's a reflection of the importance of that sector. In practice, it's going to be some weeks, and I think we're going to, again, as with other groups, look to partnerships with the health system to make sure that those shots are getting out there.
Wonderful. Next question. Given the fact that the Trump administration does not have a stockpile of second doses of the vaccine, how delayed is phase 1B now?
I think it really depends on how quickly vaccine comes off the production lines at the two companies and how quickly we get another option out there. And I simply can't quantify it. It hasn't changed. I am aware of that news story that broke today. Since we didn't have a clear schedule of how quickly we were going to get vaccine, we haven't been planning as if we were going to get this big windfall next week. So it hasn't changed our planning locally yet, but as we learn more, we'll adjust.
Great.
Well, and speaking of the Biden administration, which we were earlier, I think it's been said, or at least intimated, that the president-elect will utilize the Defense Production Act to ramp up production. So I'm hopeful.
I think this question's for Anika. Do you have publicly available metrics on the number of doses and the daily dosing rates, et cetera?
We are working on that. So hopefully sometime this week, you'll have a very basic old school, at least table that shows where we are. And then over the next couple of weeks, we're hoping to build out a public facing dashboard that people can click through and nerd out on data.
Great.
And nerd out on data, I like that. And I'm assuming that in the chat box we have included the link. If you haven't gone to these websites and the dashboards, there's some incredible information available. So we'll make that how to do that available.
Absolutely. Next question, how is Alameda County collecting the data on adverse reactions from a COVID-19 vaccine? For example, the sniff patient experiences elevated temperature, tremors, incoherence. Is there a form to be filled out by medical staff? Who does it go to? And then what about adverse reactions from the general population? And I had another question about this. If somebody had an adverse reaction, is there a form that they can fill out after the fact, after they've left the vaccination clinic?
I can talk about inside our long-term care facility. So we do have a process by which if an adverse reaction is observed by the staff or experienced by the staff, if it's experienced by the patient, we have a electronic system by which the staff collect this, and we collect this and review it in our quality and safety department. Our staff also have the ability to self-report their own adverse reactions in our own electronic system for our HR department.
Great. Next person is saying that they are confused about what groups are actually getting vaccinated. I don't know if we want to pull up the slide, Anika, if that would be easier, or if you just want to give us a run through really quick again about what groups when.
If we could do a quick screen share with the slide, I think it's really, it's very informative.
I always have it up, so I'm happy to share.
Anika and Dr. Kathleen Clannon did a wonderful presentation to the Alameda County Mayors Conference one evening this week, the 14 Alameda County mayors and city managers. And, I learned something every time I hear from her.
So this is our vaccines webpage. And if you go on that, so you can get to it from here. We also have FAQs. We also have a community advisory group that meets every 2 weeks and has, those meetings are open to the public, and that's a good way to hear about where we are, both in our county progress, as well as to hear feedback from the community on how we can really make sure that we are hitting all of the various points we need to hit on outreach and engagement. So on this guidance and resources page, which is the vaccines front page, I'll just share that these are the phases as they are as of the 13th. So phase 1 is where we are right now, and that includes healthcare workers of various kinds. The state did have them put into tiers, but then since then, they've been trying to make it easier and easier. And so it's anyone who's in phase 1A is where we are right now. And then phase 1B is coming up next. So as of right now, there are 2 tiers. Tier 1 includes people over the age of 65, as well as people in the education sector, emergency services, and food and agriculture, which includes restaurants. Tier 2 is other essential workers in transportation, critical manufacturing industries, and then incarceration settings and unhoused people. Phase 1C is the remainder of essential workers and critical infrastructure, people over age 50, and people 16 to 49 with underlying health conditions. And then phase 2 is, anybody with moderate health conditions. Children wouldn't be until phase 3, and then phase 4 is anyone who missed it in any of these other ones. But we anticipate this to be an ongoing work in progress, and what we've seen so far is that more and more people have been moved into phase 1. So we might all just be phase 1A through D or something. So, and I do just want to draw your attention to this link right up here. This is a PowerPoint that we update pretty frequently, and it just also includes some background context on how vaccine decisions get made and the various roles and what we're trying to do in Alameda County. I won't go through that.
Thank you so much, Anika. A question that popped up while you were speaking is asked, when do you estimate that 1B will start in Alameda County?
This is an excellent question. So in the coming weeks.
Okay, great. Terrific. Next person says, I'm a small business owner based in Alameda. However, some of my employees don't reside in Alameda County. All of my employees are essential employees in the infrastructure sector. Will they receive their vaccine in the county or in their home county?
Nika, I think.
I can share that. So if they fill out the employer form in our county, we will reach out to employers as their sector comes up and share information about where their employees could get vaccinated. And that could be either through those pods or through their doctor, et cetera. Like we'll share the options. There are a lot of employers who have insurance through, Kaiser or et cetera. And so it would be important for them to also partner there. And then, so you would have that option. But there are also people who might be eligible for vaccine based on age or their healthcare or their underlying health conditions. So in that case, check with your doctor or with your home county on when they're doing it.
Great. When you go to get a vaccine, what kind of proof do you need to show at your vaccine site?
Right now, we are asking for ID because we're working through healthcare workers. And so it's a government ID and some proof of your employment as a healthcare worker. And as we get into the larger and larger tiers, it's going to be harder and harder to verify people. When you register, we do ask you to, attest that you belong in whatever the turn is or the sector or tier is. Our goal is to make it as easy as possible because not everybody has an ID. And so we're figuring out ways that we can be both inviting to people to come and get vaccine, but also you will be required to share some information because we have to report it to the state.
And you also need to be able to notify people when it's time to get their second vaccine. Is that true?
Yes.
And you will never ask about immigration status. Is that correct?
We never ask about immigration status, and we are any information you share with us is kept confidential and used only for health and planning purposes.
Thanks, Anika.
Next question, maybe for Dr. Moss. What percentage of the population would be needed to be vaccinated for our society to open back up again, for schools, for everything to come back open?
Channel your inner Dr. Fauci, Dr. Moss.
Okay, so there's an important caveat to this, which is we know that these vaccines prevent illness and they prevent severe illness. We believe we have a little bit of information to suggest that they also prevent transmission. So they even for people who don't get sick, that they prevent them from getting infected and pass it on. But it's still early and that still needs to be confirmed with more data. If that's true, the estimates vary, but it could be as many as 80 or 90% of the population that need to be vaccinated or need to be immune because maybe they because of natural infection, but really we're focusing on vaccination in order to prevent the remaining folks from being at risk. And that's just because of just how efficiently this virus spreads. And I think Dr. Fauci himself has been sort of cranking up the percentage that he quotes over time because he thinks people are ready to hear that it's a pretty high number.
Yeah, that there is more confidence in the vaccine. Dr. Moss, along those lines, if someone has had COVID-19, should they still get a vaccination?
Yes, right now, vaccine, it has been tested in people who were previously infected and it's recommended for everyone.
Thank
The
you.
CDC recommends 90 days after the infection to come for the vaccine.
Okay.
This is what they are recommending now.
And is that 90 days after the infection has cleared or after being diagnosed with it?
I think it's after being diagnosed with it, 90 days. But it is safe and it is indicated to. I want to stress just an important point. If people get the vaccine they should not stop masking and social distancing.
Thank
It's
you.
very important to have this point.
Yes, yes. Thank you.
Anika, I think this one goes back to you. Somebody's saying that the Department of Developmental Services posted a letter yesterday that families who have members with developmental disabilities be considered healthcare workers and prioritized for phase 1. Some of the families don't know how to go about doing that. What should a family do and where should they go to make that happen?
If they could please register in our one of those links, the residence link on our webpage. There is also an open-ended field in there that says, is there anything else you'd like to share with us? Please, if you don't see a drop-down that identifies, what sector you might fall into, you can go ahead and fill that information in there and we can use it to search.
Great.
And then we'll notify you when vaccine's available.
Terrific. General question, why is California so low in the per capita vaccination rate? Did we receive fewer vaccines per capita or is it a problem with the rollout?
We received 3.8 million, I think, as of yesterday, and we have used about 1/3 of that. So California state population is the largest population. I don't know, probably Dr. Moss can add more information to this question.
Yeah, I mean, I think that's right. The CDC actually posts this information. The other thing that is probably hidden by some of this is that the reporting systems in California aren't super great. And that means there's a bit of a delay. And so it is taking some time for some of those numbers to be counted. So some of it is just, we're a giant, as Dr. Gemaldine shared, the reasons he shared, plus just the systems are not that great. Yeah.
And let me just chime in with a little housekeeping detail. It is actually 1:03. And we have more questions. I realize that some of our guests are on a very tight time frame. For anyone who can stay and help answer questions, I would say we could go to 1:15 and then that would be all. But anyone who can stay, please do. Thank you.
Great. And then Mayor, I will do my best to collect the questions and the answers and post them all online for folks. So if your question didn't get asked, look on the city's website on the vaccine page later today, and we'll do our best to get those answered. Next question, I think this is for Dr. Moss, I'm not sure, but do we know whether the mutant strain from Brazil has come to the United States?
Most recent information I have is that it has not been detected in the United States yet. I will tell you though, every time this happens, we say it hasn't been detected here yet, but eventually we find that it is here. So it could be here. Hard to say what that means for us at this time.
I can add a little bit about all these mutants is that the genetic surveillance in the United States is much less than the United Kingdom. Like in the United Kingdom is about like 10% of the people infected there are doing genetic surveillance. We are less than 1%. So these mutants could be present and we don't know. So, but there is some surveillance and it is increasing. So we will not be surprised if we find this mutant.
But I think, Dr. Jamaleddine, that just reemphasizes the point you made that it's very important to continue wearing your mask because now we know, we have to assume this more highly contagious variant is out there.
Next question for Dr. Moss / Dr. Fauci. What happens if more than 20% refuse to get the vaccination? So what happens then?
I think that the people who have the vaccine will not get severe illness from COVID, and in areas where we have more than whatever that threshold is, and again we don't know the exact number, they'll be protecting the more vulnerable unvaccinated members of their community, and in places where vaccination rates are lower, those people will be at greater risk.
Next person says they're a teacher in Castro Valley and they've already filled out their county spreadsheet, but should they contact their school district about getting vaccinated? Should they contact Kaiser? Where do they go?
this is a person who works for a school district, I'm guessing. From the
Works for a
question.
school district. They're a teacher in Castro Valley. Mhm.
Yeah, so I think same sign up for on our website, and it sounds like that may have been done. And then certainly could reach out to their healthcare provider. Might be a little early on both counts, as I think was shared. We're still in the healthcare provider group, which is a big group for Alameda County, about 150,000 people.
Great. For those that have pre-existing health conditions, what proof is needed to receive the vaccine in the earlier phase? Will they have to provide prescriptions or medications, note from their provider? What do they need to show?
Anika, have we delved into this detail yet? Pre-existing condition? We don't have we'll get back to you.
So on our website in the registration form, we do have a question that says, do you think you're at higher risk for complications from COVID? And then it's got a link to all of the high risk conditions. And it's just a yes, no question. We don't want to know what your health conditions are, but just that if you have any of those, you should put yes.
And Anika, I know you've explained the registration form, and I'm still getting questions from folks asking if you're over 65, how can you get a vaccine in Alameda? Can you just refresh folks that maybe joined late how they fill out that notification form and get notified?
Should I share my screen?
That'd be
Please,
wonderful.
Okay.
You can always share your screen, Anika.
All right. And I will also note that, we are working on ways for people who may not have internet access or need other support to be able to access some of these things. But right now, this is our best available tool. So if you go on our website, covid19.acgov.org, there's a vaccinations page. There's an Alameda County residents page. So you can click on that. And in this form, you will be asked your name, contact information, what occupation or sector you're in, and your age and your zip code. A little bit more, if you want to share about your race and ethnicity, it's always helpful for us to have that data. And then this is the question we just talked about, the underlying health conditions. So, this link will take you to another page that sort of talks about the various risk factors that people might have. But you don't have to tell us those. You can just say yes or no. And then as you submit this form, it goes to our team on the back end who are regularly sorting through these and sorting it against that priority framework. And then we will notify you as we have vaccine available about where you can go and get it. And for 65 and over, as Dr. Moss said, it might be a little bit early, but healthcare providers might also have it available. So it's a good idea to check with them as well.
Great, thank you. This person says Alameda County has a little over 4% of the state's population. It would seem that the county should have therefore received 4% of the state's doses. The state's received 3.8 million doses, so 4% would be over 150,000, but we've only received 85,000. Why are we not receiving what would be our fair share?
Who would like to field that one?
Let's ask Dr. Moss. Oh, wait.
There he is, Dr. Moss.
I have to be honest, I don't have a good explanation. Anika, I don't know if you do. I think that the system is not perfect and it's not doling out. It's just not distributing things perfectly right now. We should get those doses, but they're not all coming to everybody on a sort of equal time frame.
Yeah, and I think the other thing to note is that, again, for this first phase, it's based on healthcare workers. And I don't think that they have the intent to, so there might be others where, and they're all working on estimates of various populations and various groups. So it's not a clean system, and the healthcare workers dosing was not based on our overall population. It's based on number of healthcare workers, and it's expected to be metered out.
One other thing, which is we have a lot of long-term care facilities in Alameda County,
Yes.
A lot of residents,
Yep.
A lot of staff, a lot more than our neighboring counties, and maybe except Santa Clara. And that program is getting some of our vaccine doses, but we don't have any visibility into how much they've got or what they've got so far because it's a federal program with the pharmacy businesses. And so that's another thing that kind of affects the numbers.
Let me just I mean, this is a very important question related to equity. The state has launched a website called COVID Ready that all health systems had to fill in information based on their healthcare workers, on their patients' population, and accordingly they have been distributing the vaccine. And the factor of the inaccuracy of the distribution and the number is an important one. And most importantly is, as we said earlier, as Dr. Moss was saying, like our skilled nursing facility, they receive their vaccine via the Walgreens, which is a federal system.
Great.
Thank you.
Another question filled with numbers. So using the numbers provided so far today, this person writes 145,000 healthcare workers, estimating an 80% take, but each would need 2 doses, so 232,000 doses total, received 85,000 doses. Even if all of these went into the arms, we would still need 147,000 doses to finish 1A. You said you're currently doing 1,600 per day, so it would take over 3 months to complete 1A, this person asks. Hopefully the numbers given, well, this person is just saying that there seems like there's going to be a big wait until 1B is started. So they're just asking about
But
the
that's
time.
that's not a question. I think that's a statement. Is
Well,
there a question in there?
Yeah, well, I think the question is just for the timing of 1B. If we're on the track that we're on.
That 1,600 is just our pods. Is that right, Anika? Yeah. So people are also getting, like, AHS is vaccinating their own employees, Kaiser is doing their own employees, and the healthcare workers at the skilled nursing facilities are getting vaccinated through the pharmacy program. So that 1,600 isn't everything. Nonetheless, you're right. There's a lot of people to get through. Well, we don't think it's going to take 3 months.
I think if that question came from a math teacher, or if it didn't, I think that would be actually a great problem too. There's a few variables that are still needed to be determined, but I was thinking that was a pretty good math question.
Nick and Anika need to vaccinate 150,000. No.
Okay, next question. This person thought that by filling out the form that the county would coordinate with their insurer, which is Kaiser. How is the county working together with Kaiser to notify?
Anika, do you want to take that one?
Yeah, so we are actually at a regional level having conversations with Kaiser and Sutter to just make sure that there's alignment in messaging. Sorry, my 2-year-old just came in here, so now it's loud. All questions to Dr. Moss. Yeah, so we're coordinating with them, and the idea is that, you know, we just want to be very clear about communication that they're putting out to their members as well as what we're sharing.
Excellent. And then back to timing, is there any expectation for when phase 1C would start, or it's just based on supply?
Who
Dr.
wants
Moss,
to tell
or-
Supply is the answer. Okay. And you know what? My timer for 1:14 just rang. And so I want to just slip in a question or two that I had. And again, I want to thank our guests so much. It was just a pleasure. And you've enlightened us all, and we're very grateful. And I want everyone to know that the city will work with our partners at the county at AHS to also amplify these messages and let you know, keep you notified. A question, or it was at the mayor's conference meeting the other night, one of the mayors, Piedmont, mentioned that in her city, there's a lot of doctors who live in Piedmont, and they're all clamoring for when are the vaccines gonna get here? And I said, you know, why don't you recruit those doctors to help with the vaccination effort? But I'm just wondering, can we help you get vaccinators? Do you have enough? Can cities want to help the county, AHS in any way we can? But tell us, if you will, about vaccinators, and then beyond that, how can your cities partner with you?
I think that's, you know, thank you. First, I say it was really very humbling to see how many people have volunteered their time within our system, outside our system. It was so amazing to the point that we really had to put a structure to manage the volunteers and make sure that, you know, that we have enough sort of supply chain and support, because the vaccination is not only giving the vaccine. There is a registration process. We need to report to the California Immunization Registry. We need to monitor, and we need to do it safely. But that's really very humbling. And I think we will come back to answer this question, about how when people want to volunteer, how we can recruit them. I don't know if Dr. Swift, Dr. Moss want to add anything to this.
I just want to express my gratitude for everyone that has stepped forward. It has required an all hands on deck approach within the organization, and I'm sure across our county and state. Within AHS, we've had numerous nurses and doctors, providers, anyone credentialed to provide a vaccination come forward. As Dr. Jamaluddin was mentioning, we're learning like, oh, well, then now we need to create a vaccination office, a pool, a schedule, all of those activities need to be built. And so we have created a process to receive volunteers. We have some constraints because we're a healthcare system. There are some regulatory requirements that we need to meet in order to invite people to vaccinate our staff and patients.
Thank you. Anything to add, Dr. Moss?
I would just say a lot of what is true for AHS is true for us as a county. I know Dr. Jamaluddin mentioned being humbled, and I just want to say that I'm humbled that our colleagues at AHS are doing this work in the middle of the worst COVID hospital surge that we've had, and after a very difficult year. And so, I think it just has to be said that it's a difficult period right now. And then I also the cities have been important partners for us at the county throughout and will continue to be. I think that's been true in a number of ways. And so I do think there will be opportunities and we will get back to you later.
No, thank you. And on behalf of my 13 other colleague mayors in the county, we stand ready to help whenever. So I want to thank all of the audience for joining us today and being informed, and please message out to your friends and neighbors and relatives how important it is to get that vaccine when your turn comes up. I am always one to see the glasses half full, and I know that we're going to just continue to get more vaccine supply. And doesn't it just give you confidence and hope to hear from these wonderful medical and public health experts about how much is being done in our county? So thank you to all of you, Doctors Jamaluddin, Swift, and Moss, and Anika Chaudhry, always amazing Anika Chaudhry. I think she doesn't sleep, but thank you so much for your time. Sarah Henry for coordinating everything. Thank you so much, and we look forward to seeing you all again on another town hall, and again, medical and county public health folks. Thank you, thank you, thank you. All right, everyone, take care.
Thank you, Mayor. I read all the questions, but I didn't read all of the people saying thank you, and thank you to our speakers. Thank you to the mayor. Lots of appreciation. Great town hall. Thank you so much.
Thank you. All right. Ciao. Bye-bye.